السلام عليكم طلاب المرحلة الخامسة الأعزاء. Our lecture today will be on post-menopausal bleeding. هذه المحاضرة نزلت لكم بالجوجل كلاس روم، لكن بدون بصمة الصوت. هي تابعة للدكتور علي محمد مراد. أنا سجلتها بصوتي وإن شاء الله تستفادون من الشرح مالتها because it is very important lecture. Let's start. حتى نعرف شنو لازم we should understand the definition of post-menopausal bleeding. Postmenopausal bleeding it is an episode of bleeding that occur after 12 months or more after the last menstrual period. بمعنى آخر إنه ال postmenopausal bleeding can be defined as the bleeding that occurs after 12 months of amenorrhea in a woman aged 45 years and over. When amenorrhea occurs in a younger person for 1 year and a premature ovarian or menopause has been diagnosed, episode of bleeding may be classified as a postmenopausal bleeding, although resumption of ovulatory cycle can occur. شنو معناها؟ احنا عادة المينابوز راح يكون بالايج خلينا نقول من 50 55 years old، لكن اكو مرات females يصير عندهم شنو هو ovarian failure يصيرون مينابوز لكن هم younger age group، صح لو لا؟ اوكي. Sometimes after this episode of ovarian failure احتمال يصير عندنا فد function بالاوفري، اوكي، ويصير عندنا resumption of ovulation ترجع السايكل طبيعية. Any episode how can you differentiate؟ طبعا very effective to be differentiated by FSH level. FSH hormone particularly very helpful in differentiating the diagnosis between menopause versus hypothalamic amenorrhea. إذا كان ال FSH level greater than 30 milli international unit per mil is highly suggestive of menopause. إذا هذا menopause معناه هذا البليدنج صاير عندها because of يعني it is a postmenopausal bleeding. لا والله ال FSH كان أقل، لا هذا احتمال cycle رجعت لها. Okay. Now, the postmenopausal bleeding is a very common problem and occur up to 10% of a woman over the age of 55 years. The majority من عندهم majority of the postmenopausal bleeding about 90% have a benign cause. No evidence of association with the pattern of bleeding and malignancy. يعني إذا كان heavy bleeding معناها هاي عندها malignancy، وإذا أنت إذا only few drops هذه لا ما لها علاقة، ماكو any association between it. اوكي. طبعا لازم ايضا نفكر لازم نحط ببالنا انه in a woman who are not taking hormonal replacement therapy any bleeding is abnormal. لكن إذا كانت woman on combined hormonal replacement therapy خاصة إذا كان cyclical اتوقعوا حيصير عندنا bleeding بالبروجسترون free period. اوكي. ف don't forget these informations. Now, what are the causes of postmenopausal bleeding? There are many differential diagnoses of postmenopausal bleeding. خلي نبالنا لا ننسى إنه الهرمون replacement therapy، الاتروفيك endometritis، البوليب، الكانسر، هيبابليجيا، كل هذه causes. You should first of all exclude endometrial carcinoma, cervical carcinoma, vaginal atrophy which occur because of decreased estrogen which lead to the thinning of the vaginal skin. Okay, and which may result in a bleeding on the contact or touch. Endometrial hyperplasia plus minus in the polyp, which covers a wide range of changes in the endometrium. Atypical hyperplasia is a pre-malignant. Cervical polyp, hormone producing ovarian tumors, which is although rare, لكن it could be a cause خاصة granular cell tumor, theca cell tumor. Don't forget this. Also, trauma because of vaginal ring basari. A bleeding may be occur from non-genital tract, for example, from the bladder, from the rectum, okay, from the anus. All these are maybe the origin. أيضا patient أحب أنوه أنه أكو fallopian tube cancer أيضا may be a cause. Overuse of anticoagulant medication like for example aspirin, heparin, warfarin. All these are a risk factors or maybe a causes of postmenopausal bleeding. طبعا بما انه postmenopausal bleeding قلنا 10% may be a malignancy or may be associated with endometrial cancer, you should know what are the risk factors for endometrial cancer؟ لأن لما تجيك المريضة أنت وراح تشوفها أوكي أنا أعرف 90% هي benign condition لكن 10% هي malignant، أقدر أفرز من هذول 10% من هم لازم عندي risk factors for endometrial cancer. والريسك فاكتوركم تعرفوها واخذتوها بالمحاضرة ودرستوها اللي هي الايج مالتنا انه البيج انسيدنس عادة ما بين 56 إلى 57 years old، 93% عادة diagnosed at the age of 50 years and over. الباست medical history of endometrial hyperplasia or polyp، البريست or ovarian cancer، diabetic. إذا كانت البيشنت early menarche اللي هو أقل من 10 سنوات جاتها cycle or late menopause أكثر من 55 years old، هذا فيصير عندنا long time exposure of estrogen. أيضا عندنا nilliparity history of chronic anovulation إذا كان قاعد تستخدم التاموكسيفين use unopposed estrogen therapy مثل ما قلنا الأوبيسيتي الهايبرتنشن. ولا تنسون a family history of Lynch type 2 syndrome which is a hereditary non-polyposis colorectal, ovarian or endometrial cancer. All these are a risk factors for endometrial carcinoma. Now, the main aim in the primary care is to identify the cause and exclude cancer. فأي مريضة تجيك عندها postmenopausal bleeding please don't hesitate to investigate her thoroughly. الأيم مالتك هو exclude cancer. exclude cancer, don't forget. Now فراح نبدي أولا with what? with the history. Detailed history should be taken. والهيستوري مالتنا لازم يتضمن شنو؟ إنه you should confirm the menopause مثل ما قلنا when did your last menstrual period. okay. بعد إنه frequency والlength والquantity of bleeding. Any associated symptoms. Ensure that the bleeding is coming from the vagina and not from the urinary tract or the bowel. History of thyroid, kidney, liver function should be also reported. Okay. بعد عندنا إنه medication, history of any medication, for example hormonal therapy, tamoxifen, anticoagulant. Okay. Also you should ask her about any bleeding about after the coitus. يعني is there any postcoital bleeding؟ فكروا احتمال think cervical polyp, the cervical malignancy. When your last smear done, have they always been normal؟ يعني إذا كان عندنا مشكلة بالباب سمير إذا هاي معناها احتمال risk of cervical cancer. أوكي. فهو إضافة إلى أن احنا خلينا ببالنا الريسك فاكتور فور endometrial cancer ما ننساها. اوكي. فهذا بالهيستوري هاي النقاط المهمة اللي احنا لازم نتبعها ونسأل المريضة عنها. الاكزامينيشن. طبعا الاكزامينيشن you should do a physical examination, complete physical examination for the patient, and the result of physical and pelvic examination will depend on the underlying cause of the postmenopausal bleeding. طبعا first of all we should do a general examination for any pallor, any cachexia, any lymphadenopathy, examine the breast for any possible masses, tumor, okay, examine for the chest, okay. What else? Examine the hypertension, blood pressure, examine for the cardiac and respiratory sign must be excluded. The presence of all these may influence the treatment. يعني for example هاي البيشنت إذا عندها مشكلة بالchest أو بالهارت أو هاي شيء not fit for GA, not for surgery for example. وهكذا. بعد abdominal examination. A uterus that is larger than the normal may be in a case of, for instance, of fibroid or polyp or cancer. Classically, the patient with endometrial cancer عادة مو دائما يجون عندهم abdominal palpable uterus. Abdominal masses and ascites هاي معناها advanced. The presence of ovarian mass or masses suggests possibility of functioning ovarian tumor. Okay. بعد حنسوي هسه vaginal examination. Vaginal examination حنباوع على local examination, direct inspection of the vulva of the vagina for looking for any signs of lesions. يعني حباوع أني أشوف أكو signs of atrophy, area of bleeding, أكو ulcers, أكو tumors, possible of malignancy. وبعدين أسوي speculum examination. Why? For the vagina and the cervix, looking for any polyp, any atrophic changes in the vagina, any signs of infection, lesions suggestive of malignancy. Okay. وبعدين Then, before removal of the speculum, I should perform what? A Pap smear, okay? فإذا الabdominal examination هو to assess the uterus for the enlargement, for position, for mobility. في البايمانوال examination طلع very important هنشوف ال direction of the uterus وراح نشوف ال size of uterus and any palpable ovarian أو adnexal masses.